June is Alzheimer's and Brain Awareness Month, and as Maine's population continues to age, health experts say the impact of dementia is growing across the state. News Center Maine's Akua DeVal has more on growing conversations on whether the state is keeping up with the demand for care and support.
He was developing apathy and just not being his same personality that he had always been.
For Mary Dysart-Hart and her husband Mike, Alzheimer's is more than a diagnosis. It's reshaping nearly 50 years of marriage, one day at a time.
We moved into a new house. This house is 100% handicapped accessible.
Mike was diagnosed with Alzheimer's at age 62. Shortly after, Mary attended an Alzheimer's Association conference in Maine, sparking her commitment to advocacy.
We met people who were also young, who had Alzheimer's, and we're just part of a community.
Their experience reflecting a larger reality across Maine. According to the Alzheimer's Association Maine chapter, about 30,000 Mainers are living with Alzheimer's, a number experts say is expected to grow.
We see, more than 7 million Americans living with Alzheimer's, but that's projected to reach nearly 14 million by the year 2050.
Public Policy Director Jill Carney says the looming public health impact is amplified in Maine. She says receiving an early diagnosis, especially in rural parts of the state, creates a particular challenge.
The reality is, if you live in a rural area, you can be hours, from that specialist. And there are wait lists, anywhere from, maybe 4 to 6 months to up to 2 years.
Maine's Alzheimer's Association reports that behind those 30,000 Mainers living with Alzheimer's are twice as many loved ones providing unpaid care, often without formal training.
They have that commitment, they have that family bond, but then on the other end and in between, there's the frustration of it that's missing work, having to potentially retire early.
As the disease progresses, health experts say even basic communication becomes increasingly difficult, which is where hospice care can play a role.
Some individuals with dementia or Alzheimer's may progress to the point where they can't verbalize their pain levels, they can't verbalize their feelings, so it takes a lot more of an in-depth approach.
Mary says while her husband's memories might fade, their love and support for each other remains as strong as ever.
It's a tough diagnosis, but
it's not the end.
Exactly.
In Bangor, Akua DeVal, News Center Maine.
The Maine chapter of the Alzheimer's Association says it's currently advocating for a bill in the state legislature that would require insurance coverage for biomarker testing for earlier, more accurate diagnoses. They're hoping to see it passed by 2027.